Cash. This is Dr. Cash Medical and Life. Welcome back. Well, today we're starting a practice where we are doing telemedicine, telehealth, where I'm in charge of doing visits with patients at home for those who were just in the hospital for a multitude of medical. One of the patients that I'd like to just share a little bit about the visit is about post-recovery for pneumonia. Okay, bread and butter stuff for a lot of people. And so an elderly gentleman in his 60s was having fever, chills, short of breath, can't breathe, went to the hospital, did some lab tests, very abnormal, chest x-ray showed a big whopping pneumonia, and required some assistance with his breathing in addition to oxygen and antibiotics. So he was kept in the hospital for a few days. He wasn't going to make it at home, so we kept him for a few days and then sent him home. 2 days ago he went home, and he was sent home on some oxygen supplement, oxygen, antibiotics, and today we called in to do our visit to make sure he's okay. Fortunately, he's doing well. He's finishing up his antibiotics, his oxygen. He's still requiring his oxygen, but definitely doing well. Overall, still not quite back to himself, but getting stronger. Okay, so a couple of points for post hospitalization for pneumonia recovery. I think it's very important would be number one, definitely continue to stay hydrated. Lots of fluid. Doesn't have to be anything fancy. Water is fine. Milk is fine. Tea is fine. Just anything liquid and fluid. Unless the doctor mentioned to you that avoid fluid, then for some people who may have heart failure or some other fluid overloaded conditions that you may want to avoid too much fluid. If you don't have that direction from the discharging physician, then you should drink plenty of fluid to hydrate yourself up, because when you're sick, your body demands a lot from you, and if you have fever, you're losing a whole bunch of water, certainly without even knowing. And so rehydrate yourself. Number two, good nutrition. Easy, taking the food that are easy to digest, the food that are easy to go in. Avoid fatty food, avoid too much meat, and things like that. For now, eat something where it's light, where it's easy to digest, where your body can tolerate and do well. And once you fully recover, you can get back to whatever you like to eat. Okay. Number three, I will definitely avoid alcohol for now. Now that your body is just recovering, avoid alcohol, and just fluid with water, juice, tea, and things like that will also be very important. Just in case if you are a smoker, definitely a big no-no for now. It's a bad habit a difficult habit to stop, but definitely for now, do your best to stay away from smoking and avoid secondhand smoking, and avoid, such as going to the casino or any other place that will put you at risk for inhaling a lot of those irritants that can aggravate and make your pneumonia worse again. Okay, so definitely do that. So those are just some of the things that you can do to help you from your part. Now, the other important thing is, as I mentioned, that this patient was doing better as he's continuing his antibiotics. So definitely finishing up the antibiotics is extremely important. Sometimes you will only require 3 days, 5 days, 7 days, or sometimes even 10 days, depending on the nature of the infection. Some infections are easier to treat than others, and so the hospital doctor who discharged you will make that determination and just finish it up. Okay. Now, along with that, I would also suggest go ahead and picking up a bottle of probiotic from the store, from the pharmacy, over the counter, and just do it for a couple of weeks. And also maybe some yogurt. If you don't mind eating yogurt, just eat some yogurt too. This is just to replenish your gut, because when you take antibiotics, you kill the bad bacteria, but you also kill a lot of good bacteria in the guts that can also lead to problems and complications as a result of antibiotics. So definitely do that. For example, some people may develop what we call C. diff or Clostridium difficile colitis, where you have a horrible infection of the colon that can be life-threatening. So these are real issues that you have to consider when you're taking antibiotics as well. Okay. And then ultimately, finally, actually not the final point, but a second to the final point is whether you should get a vaccine or not. You know, I'm not talking about COVID vaccine, that too, but there are particular vaccine to prevent pneumonia in our patient population, particularly in the elderly. If they're past their 60s already, they should get a vaccine for prevention once every 5 years. Now, if you're in your 50s and your 40s and you caught pneumonia, it's time to get one as well, okay? And that's in general, these vaccines are relatively safe, and they prevent about maybe 25 to 30% of bacteria infection. Not all of them. Some people will complain, hey doc, you know, I got my vaccine, how come I still caught pneumonia? You know what, unfortunately, we don't have a vaccine that will cover 100% of the bugs that causes pneumonia, but 30% is better than zero. So definitely still need to get it, or strongly recommend, okay? And then finally, another point I want to make is be sure to have good follow-up, full follow-up, particularly in a certain subpopulation of patients who have pneumonia. We need to follow up and do a chest x-ray to make sure that whatever infiltrates or things that we see of the pneumonia is completely gone. Normally, we don't routinely do a chest x-ray just to recheck, but there's a certain patients that will need to have a recheck to make sure that once the body dissolves out of the pneumonia, that there's nothing behind it sitting, like a mass, like a lung cancer or something sitting there that will cause problem. And in the meantime, you assume that the pneumonia is all good, but you know something else is happening. So definitely follow up to have those done. And if you are a candidate to have repeat chest x-ray or CT scan, your doctor, normally the one that discharged you, normally will put on the discharge instructions that you will need some kind of follow-up imaging study. So that's very important to follow through. Most people, most invariably, will feel better. They will go on with life. But if the recommendation is to have a repeat chest x-ray, don't ignore that, okay? So those are some of the things that you should consider recovering from pneumonia. If you have pneumonia and you have you have any other tips or any other suggestions that have helped you to heal well and have no problems, or if you do have problem you want to share with the viewers, please put in the comments below. Or if you like this kind of materials and you like these kind of tips, consider joining my channel. And I hope to see you again next time on some other topics that as I go along I will encounter and I will post, and we will learn together. Take care, stay healthy, stay happy. Bye.